วัสดีค่ะ Welcome to Be My Guest and you're with me สดชื่นลิมเกรียงไกร In today's episode we will be looking into the pharmaceutical and medical sector of Cambodia. What will it be like? We will hear it more with our special guest today. In today's episode, we are joined by Professor Kim Sawon, Deputy Director of the Department of Hospital Services of Cambodia under the Ministry of Health. สวัสดีค่ะ Thank you for joining us today. First of all, let me ask you about the economic situation in Cambodia at the moment.
Yes, as you know, the history of Cambodia, we experienced civil war since 1968 until 1998. At that time, the economic system completely destroyed, and then we start from 0 point, and until now, the economy grow fast, and the GDP around 7%.
I see. So it's growing rapidly in the recent years.
Yes.
That is great. And what about the medical sector? As the economic is slowly growing, I'm sure that the medical sector is also growing as well.
Yes, the medical sector, we also start from 0 point because during colonization, all medical doctor mostly work here, so we start build our human resources. And until now, we have maybe around 20,000 government health staff, and we could produce our human resources. We have the private and public university produce medical doctors, students, nurses, midwives, and so on. And we have the public health system and private clinic.
I see. So is the government helping in any way to improve the medical sector?
Yes.
What do they do? Do they come with a health plan or policy?
Yes, we have the constitution that states that the health of the people have to be fair and well-being. And then Ministry of Health, our government develop many kind of legislation documents such as the policy or national social plan and the guideline and so on to implement the whole health system from national level to subnational level.
I see. So has this been implemented for quite a long time from the beginning, or it has been introduced?
It just is new introduced maybe in 1996.
Okay, so not
based on the human resources, because we don't have enough human resources to cover every district to have the hospital. That's why the government based on the population coverage to establish a hospital or health center.
I see.
Yes.
So what about your department? Yours is the hospital service department, if I'm right, under the Ministry of Health. Can you explain what do you do?
Yes, our department mostly responsible for the health service provision. As you know, in hospital, what kind of services?
Yes.
The hospital they have, we work on this, such as infection control, therapeutic islands, and so on. Yes.
I see. So when you say that, you mentioned that now you have hospitals, you're developing. Is there a lot of foreign, companies coming in terms of the medical sector? Has there been an increase of foreign investments?
Of course, especially for private sector.
In what field? Hospitals or medicines or clinics?
Both hospital, the clinic, and medical equipment, medicine. Yes.
So what do you do to attract them? What are the incentives that you offer for them to come?
Actually, the government had a policy to encourage the foreign investment to come to Cambodia, because even in our ministry we have the working group for the public and private partnership working group in order to coordinate our work to go smoothly between private and public sector.
I see.
Yes.
And what do you think is the main factors that actually help the medical sector to grow in Cambodia?
I think many factors that involved in the medical sector improve.
What do you think are they? Just an example. Is it, incentives or?
Yes, technology also contribute to medical sector development.
I see. And I've heard that there's Thai hospitals already established in Cambodia.
Yes, yes.
So was this new? Is it newly established or it has been there quite a while
I think
already?
long time ago. They got license from our department.
Oh, really? So it's actually a long time ago that they've been there. So what do the Cambodian people think of Thai hospitals? Do they think it's, a good hospital?
As you know, they depend on the user. They could use everywhere in private or public sector. They could find access to services. We don't restrict all the private or public, but we just focus on the quality of health provision.
I see. So when we talk about the medical sector, do you think it's growing only in the main cities, or it's also growing in the villages as well?
The policy direction of the Ministry of Health, we provide a service close to population, especially for people living in rural area. But actually in practice, it's very hard to develop.
For transportation, construction, everything, it's complicated.
It's complicated.
I see.
Everywhere.
But the government is supporting, right?
Yes.
I see. So when the economy is growing, people's life is getting better, and they earn more money. Does that also help them, pay more for medical services as well? Like they're willing to go for health checkup. They're willing to go to a hospital when they're sick instead of, going the traditional way. Does that increase in that as well?
Yes, people, especially for people living in rural area, sometimes they go to traditional, but we don't encourage them to go like this. We encourage them to get a service at the public hospital or private hospital, depend on their choice.
I see.
And they could check everywhere. Even in Thailand, people who live in the border area, sometimes they go to Thailand to visit the Thai hospital.
So it's like depends where they are.
Yes.
Convenience.
Yes,
as
convenient.
Well.
Yes.
So when we talk about the medical sector, there will be an exhibition as well, which will be held in September, if I'm not wrong. The Farmed Expo Cambodia. Can you tell us about that?
Yes, actually about the medical equipment promotion is very new, I think. As I attend many conferences in local, not many even talk about the health equipment promotion. So that's why I think it's also very good. The company could promote the new technology on medical equipment, because as you know, the medical equipment also provide the good health service.
Yes, of course.
Yes.
It's a main factor
as well. Yes, main factor to help our clinician to make accurate diagnostic and treatment for the patient.
Of course. It would help the doctors a lot.
Yes.
And I've known that it's not the first time that this exhibition is being held. It's actually the third time. So what was the feedback from the previous years? Were the people happy with this exhibition? Did it help in the medical sector?
As the company presented this morning, yes, the people are happy with this attendance. I hope.
See.
Of course, to promote not just first step enough, maybe we will work.
I see. So there is a possibility for opportunities to be held.
Yes.
I see.
Yes.
So when people go and visit, is it only for equipment, or there are also other services available at the exhibition as well?
Yes, I think not just only medical equipment, but also the medicine, new medicine.
So what is your expectation? Do you think this exhibition would help this time, or help with more equipment, or what is your expectation from this exhibition?
I think I expect that from the exhibition, our clinician or our doctor will learn from the even what kind of new medical equipment and technology that will suitable for them to work at the hospital level setting.
I see.
Yes.
So is it mostly, which countries are mostly the equipments from? Is it from America, from the whole world, or it's just from, Asia, or how does it work?
I think different countries. From the government sector, I think the China also provides this
China,
medical
I think.
equipment. Yes. Yes.
I see.
And
So has it grown?
from Thailand also many medical equipment, including medicine.
I see.
And from Vietnam also, yes.
So it's
And
grown.
currently one organization we call GE, General Electric Organization, from United States, also working with Ministry of Health.
I see.
And for medical equipment, JICA, JICA, also closely working with the Ministry of Health to deal with the medical equipment very strongly.
I see.
Yes.
So how many people exhibit at this exhibition? 500? Does it reach that number? Or
I think maybe company will know about this. I hope more.
So
people
how
will
many?
come.
100 at this moment, to apply? Is it still time for us to suppose a Thai company heard about this and want to join? Is there still time to apply?
I think you could contact organizer, we will know.
So it's still open
Yes,
for
still
people?
open. Yes, still open.
Okay,
Yes,
so
yes.
it's still an opportunity to join.
Yes. As the company said this morning, even in Cambodia, maybe Ministry of Commerce and Ministry of Health will support this.
I see.
Event.
So where does these clinics are from? Where are they from? Thailand or Korea or?
I think the clinic mostly from Thailand.
Oh, really?
Because as you know, the Bangkok hospital, the big one in Phnom Penh.
For cosmetic surgery as well?
Yes.
I see. So it's an ongoing trend everywhere. I see.
Yes.
And do you think that the government is gonna, send their own doctors to open up their own clinics in this department? As it's really a money-making department, actually, the cosmetic surgery.
So the policy of the Ministry of Health, we not actually the patient sometimes for the poor patient. Sometimes the government provide the health equity fund to pay for them.
I see. So it's like basic needs first at the moment.
Yes.
I see. Okay.
But for the rich people, of course, they could pay full.
I see.
But for the poor, government have the health equity fund to provide them.
So it
for
depends
free.
on the market
Yeah,
as
it
well.
depends on market.
I see.
Yes.
Well, we'll take a short break, and when we come back, we'll talk more about the topic.
Okay.
In our second break, we are still with Professor Kim Sawon, Deputy Director of the Department of Hospital Services of Cambodia under the Ministry of Health. So in our second break, let me ask you if a Thai medical company is interested to enter the Cambodian market at this time. Do you think it's a good time for them to enter the market?
For my idea, currently the existing Thai company also invest in Cambodia many years, especially in the tourist area. So Thai pharmaceutical company also should hurry up for this.
I see. So it's already been there existing for a while. I see. So what do you think? Is it a competitive market, or it's like a new market? It's open for opportunities, or it's a high competition between each company?
I think Cambodia has policy on the free markets. That's why.
I see.
Not competition, not so. We had policy on law to deal with it.
So what are the rules and regulations that a Thai company needs to know before entering the Cambodian market? What they should be aware of?
I think the best one, the new company should send the team there to get some information from the existing Thai company.
I see.
And maybe could do the feasibility study, how the medical equipment such as is needed between the public sector and private sector. But actually in public sector, as my opinion, this is very needed because our current medical equipment also some broken or some doesn't work. That's why we
like
have
old
to
technology,
old
right?
technology and
Needs
so on.
new updates.
Yeah, new updates.
I see.
And some the existing equipment such as X-ray or ultrasound, even new, but sometimes they doesn't work right. And if we cannot repair on time, maybe the health service delivery maybe disrupt.
I
Right?
understand. So do you think that right now the problem in the medical sector in Cambodia is the equipment that needs to be improved?
Yes, also yes, not
I
just only
see.
human resource improvement, but medical equipment also needs to be improved.
I see. So you think it's would be helpful if Thai companies could come into this sector,
Yes,
the equipment, and help
yes.
with this? I see that would be great actually, share the technology and information to help improve. And I've heard that recently there is an MOU between the Public Health of Thailand, the Ministry of Public Health of Thailand, and the Ministry of Health in Cambodia. So can you tell us more about that?
Yes, also I also heard about this too from Department of International Collaboration of our ministry. They talk about the collaboration between Ministry of Public Health of Thailand and Ministry of Health of Cambodia. The framework of the MOU, how the Thai partner and Cambodian partner to work to develop the health sector between these two countries. So they want the company also to study with this too, because we have the partnership between the private and public partnership to develop our health sector and economy. Yes.
I see. So it's an exchange of knowledge and ideas between the both countries.
And support each other on how to
of course.
improve.
And do you think there will be any other further future cooperation between Thailand and Cambodia in the future?
I think based on this MOU framework, so the partners should discuss what kind of the priorities should be developed on health sector.
I see. So when you say there's MOU, so it means that people will have more information about Cambodia. So that would attract more business into your country. So if they're really interested, they want some advice from your side, from the Cambodian side, who can they go to? Which department they should go? Can they go to the hospital service department, or where could they go to?
I think our department is second, but from private sector, if you're working with the Ministry of Health, Department of International Collaboration, they contact.
You have a whole department.
Yes, whole department to coordinate all the partner. Not only the private, the company, also the NGO or international organization.
When you say international collaboration, is it only for the medical sector, or does it overall?
All health sector.
Okay, I see.
Yes.
So is there any new projects by your department recently?
I think that the new project now, even our department, we need to develop the strategic plan for medical equipment.
I see.
We just have only the policy on medical equipment management, supported by JICA, developed by JICA, and adopted by Ministry of Health. But we need more about the how the strategic plan on the medical equipment to apply for all level of the.
So what's your plan?
System.
What has it been like? What is the solution at this point for this problem? Is it going to other countries, learning more, exchange staff, or buy more equipment?
Maybe we get some technical assistance from WHO or from any organization that could support us working with this.
I see.
Yes.
So, is there any advice you would like to give to the people who is interested to enter the Cambodian market in the medical sector at the moment?
For overall sector, I think yes, please come to meet our department or us, the Department of International Collaboration. They will provide useful information how to work together between Thai and Cambodia on the health development.
I see.
Yes.
Or even go to exhibit at the Farmed Expo, right?
Yes,
is that only one expo that includes the medical equipment and things like that, or is there other, exhibitions as well, which involves medical equipment, medical services, other than the Farmed Expo?
No, I know some company organize not a medical equipment but they promote some kind of treatment for medicine and so on.
But there is no exhibition or
No
no workshop.
Just as workshop or meeting between clinician and the pharmaceutical company.
I see.
Yes.
So, out of curiosity that I want to know, as you know, Thai and Cambodia, we share, similar traditions and beliefs as well. And then, the medical sector of the traditional side is also a very big part. People would rather take herbs, take, other things that's not related to medical sector. And that's also sometimes a problem here, that people prefer to go to traditional medicine instead. So in Thailand at the moment, we will support traditional medicine. Is Cambodia looking to support traditional medicine in the near future as well?
Oh, related to this about traditional medicine, Cambodia we have the National Institute for Traditional Medicine.
I see.
Even state in the ASEAN plan,
I see.
work plan.
Is it involved in hospital
Thai
as well?
is a lead all this work plan of the ASEAN.
I see.
So maybe
It's
Thai
a collaboration.
organization will work closely with the National Institute for the Traditional Medicine.
So when you say there's an institute, it's like, is it a whole...
National Center.
Yeah, a center itself, or is it combined into hospitals as well? So when people go to the hospital, they have the choice of traditional or, modern?
It's still only based in Phnom Penh, not. But people still use traditional method, as you know, the traditional healing. People still go to the monk. If they have some problem, especially for mental health problem, they go to the monk first as first line for the treatment.
Which you don't recommend, of course.
Yes, of course, some very dangerous. That's why we advise them not to go to the traditional healer. First, we try them to go to the public hospital, especially the health center, where the close service for them to access.
I see. But this, when you're talking about people who go to traditional healers, are people in the villages, I believe. Because I believe if people in the city, they would, prefer doctors instead of traditional healers if they have the choice.
No, in the city also.
Oh, really? I see.
Because we cannot change
the belief
of the people. They still believe on traditional healers many years of tradition, right? So we just advise them how to use traditional service, not with the safety. That's our goal.
I see.
Because we cannot.
You cannot stop them, but you don't recommend.
Even for the women who deliver the baby.
Yeah, they still go to the midwife.
Yes.
I see.
Yes.
I wonder sometimes why they would risk that. But maybe for emergency, sometimes they cannot travel in time to the hospital. Maybe that is a better option for them as well.
Yes, about the delivery, we have the national program to work with this. So we provide some kind of the service for the traditional midwife, how to refer the pregnant woman to health center to get the delivery there.
I see.
Because if they deliver at home, it will be very dangerous for women, right? And of course, the policy of the government, the first priority is to reduce the mortality of the maternal and child health. So that's why this will be very, very careful about with the traditional healer who provide the delivery for them. Just only refer the pregnant woman to the hospital health center. Yes.
It would be a safer option.
Yes, safe. Yes.
I see. So is there any incentives though? Because it would be more expensive to give birth to a child in a hospital.
I think the policy of the government, maybe one midwife, traditional midwife refer one pregnant woman to health center, maybe get some money.
I see. So there's an incentive
even both our staff
I
Yes,
see.
yes.
So that's great.
Yes.
Seems like the government is trying to support its
Yes, yes,
citizens
of course.
in
Yes,
the
yes.
healthcare
Yes, yes,
sector.
yes, yes, yes.
I see. That's very great indeed.
Yes, yes.
Well, that's all the time we have in this episode. Thank you so much for sharing the information with us today.
Thank you
ขอบ
for
คุณค่ะ
question.
As Cambodia economy is expanding rapidly, it also involves the medical sector as well, causing it to have room for development for areas like medical equipment and human resources. This is a good opportunity for Thai businesses to enter the market and take this a good chance to also expand their markets. And that's all the time we have for this episode. Thank you for tuning in. See you again next time. สวัสดี